Hey, my friend, would you like to know some options that you can use to reduce the aging on your face non-surgically, but also surgically? On this episode, I bring on a board-certified plastic surgeon to talk about what happens to our face as we get older with the loose, sagging skin and the jowls, and then what are some options that we have to reverse that aging on the face and the skin, again, using non-surgical options, but also surgical options. So stay tuned for a very exciting episode. If you're interested in getting thicker, fuller, and stronger hair, make sure to check out fullyvital.com. We've come up with a set of 100% natural products to stop the thinning and improve the thickness and the quality and the health of your hair. So if you're interested in that, please make sure to check out fullyvital.com. If you're enjoying the videos on this channel, please make sure to hit the subscribe button down below so you can get notified when we release new episodes. Our goal on this channel is to help you look and feel younger and live your best life. So make sure to hit the subscribe button and let's get started with the show. Hey, my friend, welcome back to the Anti-Aging Hacks podcast. Today, I have a special guest, Dr. George Bitar, who's an MD, FACS, and is an award-winning, fellowship-trained, board-certified plastic surgeon who's performed over 10,000 cosmetic, facial, and body procedures. He's the founder and medical director of the Bitar Cosmetic Surgery Institute with offices in Fairfax, Virginia, that serves a sophisticated national and international patient base, offering state-of-the-art skincare, injectables, and cosmetic surgery. Dr. Bitar obtained his medical degree from the George Washington University School of Medicine in Washington, D.C., where he now serves as an assistant clinical professor. He then finished a general surgery residency at the Albert Einstein Medical Center in Philadelphia. His plastic surgery residency was completed at the University of Virginia Plastic Surgery Program, which provided him with a strong foundation in reconstructive surgery for people injured in accidents or who have facial deformities or severe burns, and in hand surgery and microsurgery. Internationally, he trained with prominent cosmetic surgeons and learned the techniques of Dr. Ivo Petangoy, the father of Brazilian cosmetic surgery in Rio de Janeiro, Dr. Marchak in Paris, Dr. Mendelssohn in Melbourne, and Dr. Widrow in Johannesburg. With that said, Dr. Bitar, welcome to the Anti-Aging Hacks podcast.
Well, thank you very much for having me here, and I appreciate the introduction. I think I'd like to summarize it by saying I love what I do as a cosmetic surgeon. I love making people happy, and I love giving them options to look and feel their best. So I think what you do and what I do has a lot of commonality. So let's see if we can give people a little information to make them happy and to give them, some optimistic ideas that they can focus on.
Absolutely. I can't wait to get started. But before we do, I'd love to hear your background from yourself and also your medical practice, how long you've been in practice. You're definitely both certified. So walk us through your journey and what you do now.
So ever since I was a teenager, I've wanted to be a plastic surgeon. I grew up in Beirut, Lebanon, where I saw war firsthand. My father was a pediatrician, so I would go with him to the hospital and see people injured in the emergency room. And at the same time, I was developing my artistic skills. I had an uncle who was an artist, so I used to paint with him and draw, and then I liked photography. So as I grew up, I think the idea of merging medicine and art was very attractive to me. And as a surgeon who went through general surgery training, I felt that I had an artistic side that I can only express if I were a cosmetic surgeon. So I picked the top plastic surgeons in the world to train with. After I finished my formal general surgery and plastic surgery training, I did cosmetic fellowships. And then I came to Northern Virginia and the Washington, D.C. metropolitan area, opened up my institute 20 years ago. And basically, we are devoted purely to cosmetic surgery, 100%. We have a med spa that deals with the non-surgical, the skincare, and the non-surgical body tightening. We also have a surgical part of the institute that we have our own plastic surgery operating room. We have our board-certified anesthesiologist. In addition, we have our own skincare line, Model Skin, for people who want to have a medical grade skincare to take care of their skin. In addition, we have a physician assistant who is nationally recognized as a trainer for injectables, and myself. So we do a lot of injectables. I developed the model lift as a non-surgical alternative to facelifts.
Mm-hmm.
We have a fellowship program, so we train board certified or board eligible plastic surgeons to have an advanced idea of how to handle cosmetic surgery patients, from their skincare needs to their injectable and laser needs to their surgical needs. So we have been happily serving the Washington, D.C. metropolitan area and international patients for the last 20 years. And we hope to be doing it for the next 20 years as well.
Fantastic. That's a great story, and looks like you've covered it all. So I want to ask you a couple of follow-on questions there. Is your clientele more male or female?
So in a typical plastic surgeon's practice, it's about 90% female and 10% male. Yeah. In our practice, it's about 80% female and 20% male. So we have basically about 100% more male patients than the average plastic surgery practice. And the reason is when I started this institute, I wanted to make it male friendly, because in a lot of situations that I was exposed to in my residency and my fellowship, I felt that plastic surgery practices were a little intimidating for men to go to. They had a lot of female and feminine undertones and colors. And I felt, when I was a teenager, I'd go to cut my hair. If the hairstylist was more leaning towards cutting hair for women, I felt a little uncomfortable. So I didn't want my institute to feel uncomfortable for men. So we made the colors neutral, very inviting, for both sexes. Mm-hmm. And because I do surgeries that are specific for men, I do think we attract quite a bit of men. For example, I do gynecomastia, which is reduction of male breasts. Mm-hmm. I do six-pack abdomen liposuction, which is more heavily weighted towards men than women. Although we do women as well. I do a lot of rhinoplasties, and in rhinoplasties, I would say it's about 60% women, 40% men. So even though it's for both, but I do more men than for the average procedures. And then I do plastic surgery after weight loss. And there are a lot of men who, after losing 100 to 200 pounds, they need a tummy tuck, they need their arm lifts, they need a facelift. And lastly, I do facial rejuvenation that now men are catching up on, like neck lifts and chin implants and eyelid lifts. So men are looking at Instagram just like women are, and they're saying, well, if my wife or my girlfriend can have it, so can I. Yeah. The case in point, in the last 6 months, I did facelifts on 3 couples, a husband-wife, and husband-wife team. So, in 2 cases, it was the woman who came first, and then their husband came second. Mm-hmm. Case, the husband came first and his wife came second. So that's our mix.
Yeah, times are definitely changing. And in terms of the most, I guess, asked or requested surgery or thing that you do at your office, what would you say it is for men versus women procedure?
I think for men, the most thing I do is liposuction and high definition liposuction, including gynecomastia. So basically, I chisel their abdomens, their flanks, their lower back, and their chest, mm-hmm. and neck sometimes. For women, the most common procedure I'm going to say is rhinoplasties, because I do a lot of rhinoplasties and ethnic rhinoplasties. Mm. So we have about 114 countries that we have pinned on our map that people have come from, wow. Including about 50 countries that people have come from for rhinoplasties. So we do a lot of rhinoplasties for men and women, but still for women, it's more. And I think it's becoming my most commonly sought operation because I've published on it. I've given lectures about it all around the world, especially about ethnic rhinoplasties. And we have people coming from South America, from Europe, from the Middle East. I myself, wow. From Beirut, Lebanon. So I speak Arabic, I speak French, and obviously English. So we have people coming from Europe, from the Middle East to have rhinoplasties because I do their Skype consults, especially that we did during COVID. And they are comfortable with, with me as explaining to them how I would do it. And then they see the before and after pictures. They look natural. And I guess they like my work, so they come.
There we go. Okay, so let's get into what I want to talk to you about today. I want to talk about how to lift and tighten the skin on the face. But before we even do that, we've got to think about or ask, I want to ask you in terms of the face, as we get
Yes.
older, right? 20s, 30s, 40s, what's happening underneath the skin that people don't know about? Why are there jowls appearing? Why is this face moving down? What's actually going on under the skin?
So aging is a complex physiological, I guess, group of chemical reactions that happen and changes that happen in the skin and underneath the skin that the manifestations show by aging when you look at somebody. Mm-hmm. And to simplify it, there are two things that dominate, and there's an underlying thing that explains the domination of those two things. The underlying effect is basically the thinning of the collagen in the dermis, and that creates the laxity and the decrease in the sense of vibrancy and youth in the face. The overlying or the visible changes that we see are, number one, the decrease of the fat in the face that makes lush cheeks and a nice chiseled jawline and a soft, lush neck. So the fat decreases as time goes by. And because of the decrease in the elasticity, decrease in the collagen, decrease in the elastin, and the components that keep the skin having its turgor and having its bounciness, the ligaments of the face start drooping down. So what you have is you have less fat in the face, and the fat that you used to have in the cheeks now, with the ligaments getting looser and the collagen disappearing, it starts shrinking. And then instead of the fat being in the cheeks, now the fat ends in the jowls. So that is a progressive physiological changes in the face that explain a lot of what we see in the aging process. So to summarize, loss of fat in the face and loss of elasticity that allows things to kind of like head downwards with gravity.
Mm-hmm. Okay, and what age typically does this process start?
Typically it starts at age 25.
Wow.
People mature by age 25, and then slowly, the aging process starts taking effect. Mm-hmm. The body and the brain is growing, and your neurons in the brain are, creating synapses. Your brain is growing up to 25, and I'm sorry to say, but it's downhill from there.
It's funny. I lived in Los Angeles before this, and it's a very sensitive town towards aging. And I would have women tell me that were 26 or 27. They would say, "Oh, I'm getting older." And I would look at them and laugh. I'm like, "What are you talking about? You're 26 or you're 27." But what you're saying now starts to make sense, because I can't tell that there's anything different with them, but maybe they can spot some micro changes in their face, and they're starting to see it going downhill. So,
high def photography doesn't help.
Yeah, that's true. That too. That exposes all your flaws. Okay, so I want to ask you, the jowls is something I want to come back to, because that's problematic for a lot of people. But in terms of laying down the framework of how we would approach something or things we could do to reverse this aging, stop it, or address it earlier than later, there's, I think, three components we want to talk about. One is things that people can do from home. One is things that they can do without surgery. And then a third component obviously is doing facial surgery or whatnot, or neck surgery. So how would you describe all of those components from your perspective, Dr. Bitar?
So the first thing I say is I'm a doctor before being a plastic surgeon, and I would like to promote health and healthy habits and doing the things that are right for you, before working up the chain to the things that are sophisticated and expensive, and that you can avoid if you do the easy and basic things first. Mm-hmm. It makes no sense to me when somebody comes to my office requesting liposuction, but then they have a horrible diet. Right. I can't help you if you can't help yourself. Mm-hmm. And I don't ever suggest or promote that liposuction is a weight loss modality. It is a body contouring modality, But before you get to weight loss by liposuction or by body contouring by liposuction, there are basic things that people need to do before they come and ask me why things are not working out for them. Somebody who sat in the sun their whole life and at age 70 now wants me to give them, cheeks that look like a baby's behind is going to be difficult,
Yeah.
So there are some things that are common sense, and I try to start out by doing that. And one example is smoking. I mean, smoking is bad on many levels, whether it's for your heart, for your arteries, for your liver, for your kidneys, but it's also bad for your skin. So somebody comes to me and wants me to operate on them, I make them stop smoking a month before and a month after the surgery. And I tell them, I said, if I'm doing a tummy tuck on you or a breast lift or a facelift, and I'm able to make you stop smoking a month before and a month after the surgery, and you're able to stop smoking completely, to me, your stopping smoking is 100 times more valuable than your tummy tuck or your facelift or your breast lift.
Right.
So I like to start out by being a doctor first. And so the things that are common and the things that are, traditional wisdom still hold. So I like my patients to stop smoking. I think, we have now enough evidence to say that, George Burns may have lived to be 100 while he smoked a cigar, but he's the exception. He's not the rule.
Right.
So stop smoking is one. Hydrate yourself, drinking water, I think, and keeping hydrated is very important. I also like patients to overdo it. People who come to my office with a gallon of water that they want to drink every 2 hours, everything I think in excess does not make sense to me. I'm very practical, as a guy and as a doctor. So stopping smoking is one, hydrating yourself is two, avoiding the sun or using sunscreen of SPF of 35 and above. I plead guilty in liking to be in the sun and liking the fun in the sun, but I also feel that you can do both. You can enjoy yourself in the sun and you can use some sunscreen. Especially if somebody is light-skinned and they are predisposed to sun cancer or skin cancer from the sun, like melanoma or squamous cell carcinoma. But even if you're not prone to skin cancer, I think the damage that the sun does for your skin is irreversible.
Right.
We can improve it, but we cannot walk it back. I worked for a dermatologist when I was in college who used to tell the patients, God may forgive you, but your skin won't. So things that you have done, I have people coming to me wanting better skincare in their 60s and 70s. And I say, you sat in the sun a lot when you were teenagers. Yeah, for the last 10 years, I've taken very good care of my skin. Well, it's too late.
Right.
So sun avoidance, hydration, stop smoking, that 6 to 8 hours of sleep a night is very important, if you can do it. Some people can survive on less sleep, but if you cannot, I think it's important. And things that make you relax. For me, painting and photography and spending time with my kids make me relax. Some people, it's yoga. I can't do yoga. It's just, not for me, but for other people, meditation and yoga is wonderful.
Yeah.
So things that can make you relax. So all these things don't cost you anything and are probably more valuable than anything I can offer you.
Nice. Yeah. Okay. So that's the preventative side of things, which you can do at home for free. And these are just healthy habits that you would recommend to people long-term. And yes,
the one thing I also forgot to mention, I'm sorry, is alcohol drinking. I mean, alcohol moderation is good, but alcohol in excess can cause liver damage, can cause mental problems, can cause irritation and nervousness in your, personality. That doesn't help, anything, as far as you trying to create a healthy lifestyle. So I would add that to the list that you can do and save yourself money by not doing.
Yeah. I walk outside and when I'm in the city or doing whatever, and I see people laying out in the sun, and I shake my head because I'm like, man, you're destroying skin cells. Yeah, if you're doing it for a little bit and you're doing it every day, maybe 15, 20 minutes, perfect. Yeah, you're going to get vitamin D. But if you're going to lay there for 3 hours every weekend, you're gonna not look so hot or not so good when you're older. So, but it's not my place to say anything. I just kind of think to myself as I'm walking by them. Okay, so
Well, then these people that you see come to me and want me to laser their skin. I'm like,
right.
you cannot be creating the damage and then ask me to fix it. Then the next summer, go back and create more damage.
Right. I mean, it provides good monetary flow for you, but still, as a doctor, I think you worry about that, right? You don't want to like constantly be reversing people's damage. You want them to be proactive. So I get that. So let's talk about, we talked about the proactive side of things. What about the non-surgical options? And I am especially interested in asking you what you said earlier is when your fat moves down from your cheeks and your jowls get big and heavy and your face goes from an oval or a triangle to more of a rectangular face. What can we do non-surgically to kind of help that, reverse that, improve that?
So, I think I've had my practice now for 20 years. I think we live in the most exciting time for cosmetic surgery right now. And I don't say I'm a cosmetic surgeon. I just simply say it because the technology that we have right now and the options did not even exist when I was in my training. In my training, I did 0 injectables because they did not exist.
Mm-hmm.
So we have injectables, we have lasers, we have skincare that is medical grade. We have skin tightening devices with radio frequency. We have skin tightening devices that are ultrasound based. So this is a very exciting time for people to be able to take care of themselves without having surgery. And as a cosmetic surgeon, I love to operate, but if I can make somebody happy without having to cut on them and give them the same level of satisfaction, or maybe not as much, but good enough without them undergoing the knife, I love doing that. And one of the nice things I think I like about our institute is because we have a med spa and a surgery center side by side, we're literally separated by a hallway. The patients get to choose and we offer them things that make sense for them. So if you want to start out by, the baseline of improving the skin is good skincare, and we have estheticians that sit down and talk to patients about things that are going to improve the blemishes in their skin, things that are going to improve the wrinkles in their skin, things that are going to increase the collagen production, things that are going to maintain the moisture in their skin, things that they can do in the morning and do at night. And I can go into great detail, but that's kind of like beyond the scope of, this topic. But skincare by itself is a whole new, topic. And we have our own skincare line that was problem-based. You take this in the morning if you have dry skin. You take this if you have loss of collagen and you have very thin skin. You take this at night if you have oily skin and you want to dry it up a little bit. You take this if you have very blemishes, or somebody who has melasma or the mask of pregnancy. And because we have a very varied ethnic practice, from very light skin to very dark skin, we have adjusted our skincare regimens to be able to treat all skin colors. And there is the science and the art of treating patients. And I think our estheticians have mastered both the science and the art of giving somebody the skincare that matches their skin. So that's the first level of treatment. The second level of the skin is, if you've done skincare and you want something a little bit stronger, or the damage of the sun, or your own wear and tear, so to speak. People come to us sometimes with very deep wrinkles because they lived in harsh conditions, and now they want to have nicer skin, and skincare may help, but it's not strong enough. Then we can go to lasers, and lasers work in different ways. Some lasers target the red pigment, in which case they deal with blood vessels or decreasing pigmented lesions on the face, like a blotch, like the one that Gorbachev had on his forehead. If people have to remember that. Yeah. Then you have the spider veins that get treated by lasers that target, the red pigment. Then you have the lasers that target hair pigment or the dark pigment that are there to reduce the hair follicles and basically remove hair by laser. And then you have the lasers that are there to improve the skin and the wrinkles. And those lasers function by the wavelength where they evaporate the water. So if you laser the skin and remove the water from it, you're going to create a superficial burn, and you get rid of that layer that has the keratin in it, or the top layer of the skin where the dead skin has layered, and now you have new skin. So laser would be the next step after a good regimen of skincare.
Mm-hmm. Okay, fantastic. I am particularly interested. I've been researching radio frequency microneedling and also ultrasound for the last few months in terms of devising a protocol. And of course, we could talk about lasers all day long. And I feel like that's such a big topic that I want to leave that aside for a future discussion. But if you could, let's get into a little bit of detail on radio frequency and radio frequency microneedling, if that's okay, Dr. Bitar. And
Sure.
Can you explain how that works, first of all, for people?
So with radio frequency, there's a current that goes and is mostly a general current that attacks the dermis and the underlying skin. It heats up that layer and it stimulates some of the cells, it's called the myofibroblast, to create more collagen. Mm-hmm. And it's not an immediate effect. It takes a while for radio frequency to bear fruit. But essentially what you're doing is you're stimulating the cells that cause collagen, and you're doing it in a generalized manner, throughout the whole area that gets treated. So for example, you can treat the whole face, you can treat the abdomen, you can treat the elbow, you can treat the knee. And the goal is to heat that area. So with the endpoint in mind, that where you're creating that heat with radio frequency, it's a form of energy. It stimulates the fibroblasts that create collagens for them to produce collagen in the next 3 to 6 months. Mm. Unlike laser, where you're targeting the superficial layer of the skin and you're burning the keratin layer or the dead skins, and now you have, what looks like a sunburn. And now, I tell people you're going to look like a pizza face, because then the new skin will regenerate. The radio frequency will not have any effect on the top layer of the skin. What it's doing is it's creating basically an injury or thermal injury or a heat injury to the underlying dermal layer that later will create collagen, stimulates collagen, and thicken that layer, so that those fine wrinkles or that laxity of the skin gets improved because you are adding more collagen to it, and essentially reversing the aging process. Because as we age, the collagen layer thins down, and the turgor of the skin and the elasticity of the skin, is no longer there. So radio frequency is counterbalancing that by forcing your remaining cells that create collagen to create more collagen and thicken the collagen that's in the layer under the skin. Mm-hmm. That's how frequency works.
Okay. And is that with radio frequency, how deep are we going? So you said it's not superficial, which great, but how many millimeters deep is it going?
It's like a 1 to 3 millimeter range. It's not deep, because now the next step is going to be the therapy or the ultrasound treatment. Mm-hmm. Ultrasound treatment, the way it differs from radio frequency is it's more targeted. So you can go 1 millimeter, which is right down to the dermis. You can go 3 millimeters, which is down to between the dermis and the fatty layer. And you can go down 4.5 to 5 millimeters, which is between the fatty layer and the muscle, where there is that thick fascial tissue. And Ultherapy, which is a machine that we've been using for about 10 years now, has been the only FDA-approved machine to create a non-surgical facelift. And the reason for that is because it penetrates deeper than the radio frequency does. It has basically three modules. The first module, you go down to the 1 millimeter, so you're down to the dermis. The second layer, you go down to between the dermis and the fat, the subcutaneous layer. And the third module, you go down between the fat and the muscle layer, where the thick collagen or the thick connective tissue lies. And the way that the ultrasound works is it's the same probe that you do ultrasounds for a baby in the wound, or the ultrasound in the neck if you have a lump, or the breast. The difference is that in this case, it's not just a diagnostic tool, it's also a treatment tool. So when the probe in the hand of the operator locates the layer where you want to target, then you zap it and creates a small burn to that area. So you can control where you're creating a pinpoint burn. And when you create thousands of burns at the 1 millimeter level, or the 3 millimeter level, or the 4.5 millimeter level, those thousands of burns, when you burn the collagen, what it does is the connective tissue contracts a little bit. So when you have thousands of small burns under the skin, that heat adds up and the connective tissue tightens, and that's what creates the lift.
Right. Gotcha.
Okay, the third modality, because I'm going to kind of tie it all together. The third modality is the microneedling, and what it is essentially a electric current where you go in and you burn the skin at a superficial layer. So whereas the ultrasound burns the deeper part of the skin, you don't see anything on the surface. The microneedle, you see actual pinpoint burns on the skin. So when you create pinpoint burns on the skin with microneedling, and you combine that with radiofrequency, that's what you're talking about. The Morpheus machine and other machines that are basically a combination of the microneedling technology and the radiofrequency technology together. So one is targeted at the superficial layers of the skin that handles the visible wrinkles or the visible unevenness in the skin, and one is underneath to create more collagen buildup. So the two are synergistic.
Okay, I got you. So I use microneedling I've done it multiple times from home, and I push the limits a little bit, but I know that people should be more careful, and if they're going to deeper depths, then they should go see an expert, of course. With that said, what out of these three, I would assume that radiofrequency microneedling would be more effective than just radiofrequency by itself, correct? Not only at the superficial level, but also going deeper. Is that fair to say, or are they equal?
It's fair to say, but it may be also overkill. In other words, you want to handle somebody's skin. I tell people, you need to handle the skin with the severity that is appropriate. Somebody who has a very nice skin, I would just put them on a skincare regimen without doing anything more invasive.
Right.
Also, by the same token, somebody with a little bit of sun damage and aging process, you may do radiofrequency on them and they may be very happy, and they may avoid having multiple treatments of microneedling.
Mm-hmm.
What you said is true. If you want to go for an aggressive treatment, then the microneedling plus the radiofrequency is more aggressive and creates more of an effect and more of a change in the skin than each one alone. That's a correct treatment. But, I think those are tools. I think the aspect is the operator, whether it's an esthetician or a nurse or a physician assistant or a doctor who's treating a patient, to be able to create a regimen that is appropriate for that patient.
Right.
I'd like to over-treat somebody, and sometimes maybe under-treating them is not great, but it creates a way to give you a moderate result before you jump and create a very aggressive result, because sometimes just a small and moderate result may work, and you avoid having more expenses and more downtime and more trauma and more pain to the skin.
Mm-hmm. Okay, fair. Let me ask you a different question. I know that as your fat moves down into your jowls, you almost want to get rid of the fat around your chin, around your jawline, but you want to keep the fat in your cheeks and above, around your eyes, if you will. So how would radiofrequency or radiofrequency microneedling or even ultrasound, alt therapy device, how would that be handled? Because at one point you want to reduce the fat, at the other point you want to keep the fat.
Fair enough. So let me be clear. I think it's the fat itself is sort of held by connective tissue, and it's that laxity of the connective tissue that increases with age, so things kind of like start sagging. The very short answer is the best way to reposition that fat back into the cheeks is a facelift, which I do very frequently. And essentially what I do is I lift up the skin, and now I'm looking at the fat, and basically I lift the fat in the vector that it descended in, and I suture it. So I suture it up on the cheek. So when I'm doing a facelift, when you look at one side of the face versus the other, you can clearly see the difference. So that is the most definitive way to reposition the fat and to bring it back to where it came down from.
Gotcha.
And as a plastic surgeon, that's the thing that I like to do the most because it has the most dramatic and most effective result. And plenty of pictures on my website, on my Instagram to show people what I'm talking about.
So I'll ask you, one question about facelift, and I want to come back to these things, and then we'll go back to the facelift.
Sure.
So let's say if you do a facelift, it's a very invasive procedure.
Yes.
I've heard people say it can reduce 10 years or take off 10 years off your face or maybe more. Is that fair?
That's very fair. I tell people about 20 years.
20 years. Okay. Wow.
Yeah.
Okay.
I tell them sometimes they have to be worried about getting carded again.
That's a good problem to have for people listening. Okay. So let's say that's a 20-year difference, which is spectacular. But also it's invasive.
I have people who are upset that when I do a facelift on them, they look only 20 years younger, not 40 years younger. I'm like, I'm a plastic surgeon. I'm not a magician.
Right. Okay. So then if we come back to the other three items we talked about, which is radiofrequency, microneedling, and L therapy, how many years of reversing the face damage or the aging can you go with these three therapies?
I mean, that's a very general question. I mean, it has to do also with that specific person and with setting realistic expectations. But I can tell you that of those three, I think L therapy is the most effective because it penetrates the deepest. Microneedling is not going to do anything for the fat because it's very superficial. It will improve the skin quality. Right. It's not going to do anything for the contouring of the face. Microneedling and radiofrequency will help tighten things a little bit, but it's not going to be a huge game changer. I think L therapy is. I think that's where we segue into the model lift that I talked about before, because the model lift is meant to mask the problem, whereas a facelift fixes the problem. So if somebody has descending jowls, if I do injectables on them, I'm not going to be able to lift up the fat. But if I put some fillers in the cheeks, that does three things. It improves the cheek contour. It pulls on the smile lines, so it gives less of a depth of the smile line simply by virtue of lifting the cheeks. And as you guessed, is going to reduce the jowls a little bit because it's going to create an upward effect. The second thing I do is by injecting fillers, and we have a fellowship program, so I do train my fellows and tell them, you may not be able to get rid of the jowls, but if you inject fillers behind the jowls and in front of the jowls, including the chin, now you create a more even jaw contour. And for the eye that looks at that, when you see a more straight jaw contour, including the chin, it creates a more youthful image, even though you've not gotten rid of the jowls, but you created a more evenness with the rest of the jawline.
I got you. Okay, so that's another tool in your arsenal that you can use with or without any of these other items we've talked about. Other procedures.
And we usually use them in conjunction with each other. Okay. I do a lot of fillers and L therapy. So L therapy tightens the skin, lifts up a little bit, and the fillers fill. So, the people who've lost the fat in their cheeks, the L therapy can tighten and lift up the skin, but the fillers can volumize the cheeks and give somebody, their 18 and 19-year-old cheeks again.
Nice. What are we talking? Are these hyaluronic acid fillers, or are they other materials?
So there are the three types of fillers that are the main fillers on the market is hyaluronic acid. There is the calcium based like Radiesse, And there is the more longer term fillers like Sculptra and Bellafill that have more of a 3 to 5 year component. I personally like the Radius that lasts about 1 to 2 years, and the hyaluronic acid that lasts about 9 months to a year. And I like to put them in different places. So the areas that I want to create contouring, like the cheeks, the nose, and the jawline, including the chin, I like Radius because it's calcium based, and that can last a long time. And when you inject it right on the bone, it stimulates collagen formation, and it does have a long lasting effect. I like the hyaluronic acid in areas that are softer. For example, the lips, the under eyes, and the smile lines, unless the smile lines are so deep that they need to be injected with Radius or the more longer term injectables. Sculptra, is something we're doing a study on right now, which is also a longer lasting filler, can be dissolved and diluted with a solvent and injected in the whole face to create collagen and stimulate collagen that is general, not in one specific area. We use that for the face, and I also use that for injecting in the buttocks when people want to have a more rounded buttocks but don't have their own fat to do it, because that's a Brazilian butt lift with their own fat. But there are women who are very skinny, so we do injectables to create a more contoured buttock, just the same technique that I create a more contoured cheek line and jawline.
Mm-hmm. Got it. So I know there's a plethora of options, especially when it comes to fillers, and they've been around for a long time. But for people that are looking for very, very natural options that have no exogenous substances that are going into their body, is hyaluronic acid then the one that you would prefer over others if somebody had that concern, or are all of these very natural?
I mean, they are all very natural and safe. And because they've passed through FDA approval, one of the things that we have in this country that is a blessing is the FDA stopping dangerous products from coming into people's faces and under their skin. So like Botox and Dysport and Jowls and the other fillers, the muscle relaxants that we use have all been vetted by the FDA. The other hyaluronic acid fillers like Restylane, Juvederm, and the different families with Bellotero from a different company, and the calcium-based, the PMMA, or the different types of molecules that you inject, I think have all been vetted and are all very safe. Now, that doesn't mean that they need to be injected willy-nilly. I think the injector who's injecting them has the responsibility to learn the anatomy of the face, make sure they're avoiding the nerves, the arteries, the veins, and injecting it safely. Because, like anything, they can be dangerous if they are used improperly. But in the hands of an experienced injector, I've done over 100,000 injections. So in the hands of experienced injector, I think they're very safe. As far as your question is concerned, what do I think is the best injection? My answer is none of the above. My favorite injection is the person's own fat. And I've been doing fat grafting. I trained with the guy who originated fat grafting because I did a fellowship in Beverly Hills. So I do a lot of volumizing of the face with the person's own fat. That doesn't get a lot of attention from the media because nobody makes money when you inject the person's own fat. Right. Those companies that have all these injectables make money. So fat grafting, I think, is the most natural substance to inject fillers. It's the most long-lasting and readily available. But it is a surgery. So those injectables can be done in an office setting without having to worry about, taking fat from one part of their body and injecting it in their face. But fat is the most safe and most natural. But the others that we have mentioned are also, safe, and they have been vetted by the FDA. And over 20 years, I've not seen, out of the unusual complications. There are redness, irritation. Some people may be allergic to a component of it, but I can count them on the fingers of one hand over a 20-year period. So it's not that common.
I got you. So I guess if I were to pick fat grafting from certain other areas of my body where I have more fat and inject it in the top half of my face where there's stuff moving down, or for anybody else that's listening, and then so you can volumize that top area, the top half of the face, but the bottom half is already drooping. So could you then kill, I don't want to say kill, but like vaporize the fat in the bottom area and then add fat at the top? And now you've got a more balanced face just with fat grafting? How would you do that, I guess?
I mean, the answer is yes. I don't want to vaporize the fat. I can liposuction the fat in the jowls. I can liposuction the fat in the neck.
Mm-hmm.
I can heat it by, we have other fat treatment modalities like Cool Sculpt, where you can freeze the fat.
Mm-hmm.
I have other modalities like Kybella, that is a injection that you inject in the fat, and it blasts the walls of the fat cells, so it kills the fat cells, and then the body absorbs it. So either mechanically, chemically, or thermally, we can burn the fat. Either we can burn it, we can freeze it, we can suction it. So we can remove fat from the areas that we don't want. And then, yes, we can inject it in the areas that have paucity of fat, like the cheeks, the smile lines, the temples. As we get older, the temples start skimming, and I use fat grafting as a modality with almost every facelift that I do. So when I'm doing a facelift, everybody who gets a facelift has usually some areas in their face that they could benefit from injecting the fat. So whether I'm doing eyelid lifts and a facelift, and I want to inject a little bit of fat in their cheeks or in their lips or in their temples or in their jawline, I'm very liberal in injecting fat to improve the facial contour.
Okay, and we're coming up on time, so I want to be sensitive to your time, Dr. Bitar.
Sure.
I guess last question on the fat front, and I talked to again some plastic surgeons 2 or 3 years ago, and they were concerned that when you move fat from one area to a different area, a lot of that fat doesn't hold, it dissipates, it leaves. So you're never sure what the end result is going to be in the target area. Is that still true, or have you made improvements in that area since?
Both. It's still true, and we have made improvements.
Okay.
There are different modalities of trying to make that fat last longer. There is microfat injections. There is cleaning up the fat and removing the components that can make it not last long. So every plastic surgeon has their own technique of twisting the fat, cleaning the fat, and injecting the fat. But I think at the end of the day, I usually tell the patients about 50% of the fat that I inject is probably going to remain. So if I'm targeting about 3 cc's of fat in each cheek, I'm probably going to put 6 cc's so that 3 of them remain. So if a patient a month after the surgery tells me, oh my God, I love my cheeks, I hope they don't come down, I'm going to say they're going to come down. We'll assess your result at the 1-year mark, not at the 3-month mark.
I got you.
And vice versa. If somebody tells me that, oh my God, my cheeks look like a chipmunk, I cannot live like that, I'm going to tell them, relax, it's going to come down. So yes, I think if we want to be honest with our patients, we have to explain to them that injecting the fat is not going to be as predictable as when you inject a filler, because it's alive, and because in order for it to survive, it needs to have blood supply. Then it takes a while for the fat that we inject to get blood supply and give us the final outcome.
Okay.
20-year experience. So I feel very comfortable when I tell patients injecting you with fat is going to give you a very nice contour to your face. Yeah. The other thing I would add to that is one of the main differences of fat versus fillers is the fat is biological, and it comes with growth factors and comes with additional factors in the skin, like stem cells and the fluid that you harvest it in, that has certain components that improve the quality of the overlying skin. So when you fat in the cheeks and in the face, it's not only just a filler to fill the cheek, but there is a biological component to it that improves the surrounding where you inject it. And that has been proven scientifically. And that's one thing I tell because my patients tell me, well, if I'm asleep, why put fat in my cheeks as opposed to filler? And my answer to them is, besides the fact that fat is a longer lasting filler, it also has a biological component that enhances blood supply, enhances the skin texture and quality where you inject it.
Right, right. That's a fantastic point. And I think you just mentioned this as well in terms of longer lasting. You mentioned for the fillers how long each of them lasts, but could you go back, please, and tell us for the fat how long this will last? Meaning, if you do one of those procedures, how long you can expect to hang out until you have to do one more? And then same thing for radiofrequency microneedling, and therapy or ultrasound, please.
Sure. So in the order that you mentioned, fat, I usually tell people it takes about a year to see how much of it is going to survive, and usually about 50%. But then when that 50% survives, then it's going to behave the same way as it would have if it was naturally in your cheeks. Most of fillers that are going to stay as a constant quantity, and then as time goes by, the body's going to absorb them. The fat is going to be alive, and then if you gain weight, that fat can grow, and if you lose weight, that fat can shrivel. So it will depend on your weight and how it fluctuates. Now, the way it also behaves naturally is, even if we put fat in somebody's cheeks at their 40s and it looks good, naturally the body is going to absorb some of that fat with the aging process. So it will behave the same way as if there was natural fat there, not fat that you've imported from the abdomen or from the thigh.
I got you.
That's fat. As far as the other treatments, whether it's radiofrequency or alt therapy, I usually say it's a 2 to 7 year window. Sometimes it's earlier, sometimes it's more, but it depends on so many variables that it's difficult to make a generalization. You know, whether you do it on a 20-year-old or a 70-year-old, whether you do it on somebody who, after you do it on, takes care of themselves, you know, avoids the sun versus does everything they can to ruin their skin. You do it on somebody who naturally has more collagen in their face than not. If the person who's doing it is an aggressive operator, you know, alt therapy, not all alt therapies are created equal. We have a medically directed med spa, and my estheticians, because I'm their medical director, are aggressive. So, for example, doing 1,000 points for the alt therapy, they may do 3,000 points. So that alt therapy treatment is going to last longer than if the person had 1,000 hits, because the scar tissue and the aggressive behavior or the aggressive treatment is going to lift up the skin and keep it up a little bit longer. So it's difficult for me to generalize how long these treatments will last because of all the variables that I've discussed. But at the end of the day, they are non-surgical and a patient can do them. I think with microneedling, to get a really good result, you need about 3 to 5 treatments spaced about 3 months apart. Alt therapy, I tell people typically it's a one-time treatment, and radiofrequency, it can be 3 to 5 treatments, which alt therapy has a more aggressive result on the skin and the lifting of the skin.
Fantastic. There you have it. Yeah.
We go to the surgical treatments, so like a facelift or eyelid lifts that are pretty much permanent. You know, they're not going to stop the aging process, but they're going to make your face always look better than it was if you had not had an eyelid lift or you've not had a facelift.
Okay, so that's the surgical component. I want to give you the opportunity to also talk about those before we end the interview. And so we've talked about so far proactive steps that you can take to reduce even needing some of these procedures. And then you've talked about non-surgical options. What about surgical options? And what do you in particular do to reverse aging, facial aging by 10, 20 years?
So I like to simplify things for my patients, and I like to explain to them that the facial procedures should address their specific needs. So, for example, I do a forehead lift on the forehead if the forehead sags. And there are different ways of doing a forehead. From the middle of the head, you can lift. From the sides of the head, you can lift the temporal areas. A brow pexy or a smaller version of a brow lift is when I do an upper eyelid lift and the scar is already open. I go and suture the brows to the bone above where the eyeballs sit. So there are different ways of, tackling the forehead, and that has to be discussed with a board certified plastic surgeon who is experienced in those, because there is a risk of having nerve damage and not being able to open up your eyes properly. So it's a serious operation. This procedure has been dramatically decreased by the use of Botox and by use of the non-surgical injections or neurotoxins that we use, Botox, Dysport, Jeuveau, or Xeomin, which are the Botox equivalents that not only paralyze the muscles, but you're able to do a brow lift by decreasing the action of the muscles that pull down the eyebrows and not interfering with the muscles that lift the eyebrows. There's a science and an art to that. We go down, and the upper lower eyelid lifts is pretty straightforward. It's an upper eyelid lift and a lower eyelid lift that removes the extra skin and removes the extra fat and creates a nicer, more youthful contour of the eye. So if somebody's eyes are sagging on the side, we lift up the corners of the eyes. And if you do that in a dramatic fashion, you create the fox eyes, or the cat eyes that are very popular on Instagram, and people ask for that sometimes. If somebody is not interested in doing surgery, you can also do some laser tightening of the skin around the eyes. It does not give you the same effect as surgery, but it can give you an improvement. Somebody who is younger, who's bothered by the bags under their eyes, I would always offer them the surgical option, but I also offer them the non-surgical option, which is a filler, and I fill the tear trough or the bags under the eyes. So you're not really fixing the problem, but you are masking the problem. Instead of seeing a bulge in the fat under the eyes and the bulge in the cheeks and the hollowness in the middle, by filling that hollowness with a filler, now you created a nice transition between the eyes and the cheeks. So the bags under the eyes, even though you have not removed them, but now they don't show as much. And I quite a bit of a non-surgical lower eyelid treatments if it does not want to have surgery. Now, when it comes to the cheeks, if somebody has very chubby cheeks, one procedure that has become very popular lately is the buccal fat pad removals. So I go from inside the mouth and remove the buccal fats, which are the fat pads that create the chipmunk look. And that's a quick and easy procedure. It can be done under general anesthesia or under local anesthesia, because you go from inside the cheeks, pop the fat out, and it creates a little bit of that contour reduction if somebody has, very chubby cheeks. Moving down, if you take care of the cheeks and the neck, that is a facelift. And I do a lot of facelifts, neck lifts, just only neck lifts, or neck lifts with cheeks, which is a facelift. I have my own technique of a suture suspension neck lift, which basically tightens the muscles of the neck in a way that creates a nice jawline. And when you combine that with lifting up the fat in the cheeks from the jowls to the cheeks, it creates a very nice, youthful, and natural look for the cheeks and the neck, i.e. the whole face. So that's kind of like a 5-minute rundown on all surgical procedures that we can do for the face.
Fantastic. There you have it, folks. You have options upon options, non-surgical, surgical, for you to regain your youth, so to speak. Of course, you want to do all the internal stuff and all the anti-aging tools and technologies that we have available to us. But it looks like, thank you for educating me also, Dr. Bitar. Looks like there's a plethora of options. And if you're interested, then definitely reach out to Dr. Bitar and schedule a consult or what have you. Where can people find you and access your med spa line or your skincare?
So we are very easy to find. We're in Northern Virginia. Our website is www.bitarinstitute.com, BITAR institute.com. Our Instagram, that's very active, is at the Bitar Institute, is our handle name. Again, the Bitar Institute. And I think if you want to come to see me, I'd be more than delighted to help your listeners. But I also would like to say for practical purposes, I think the most important thing about all the things that we discussed is not the treatment, but the person who's doing it. So please pick a board certified plastic surgeon and stay out of trouble in the first place, because I would say 2/3 of my practice is secondary procedures, doing things on people that were not happy with the first one that they did. So about 60% of my nose jobs are doing rhinoplasties on people who've had them done before and were not happy with them. And sometimes I'm doing the 6th nose job or the 7th nose job. So
Wow.
I'd rather it be done right the first time.
Yeah.
I always tell people, you know, the 3 things that you don't want to skimp on is your scuba gear, your parachute, and your plastic surgery. And I think you can understand understand the implications.
Well said. Well said. Okay. Fantastic, Dr. Bitar. Thank you so much for coming on. And we'd love to have you back in the future. And thank you for educating our listeners so much.
It'd be my pleasure. Thanks again for having me.
Okay. Take care.
Bye.